Okay, great. Thank you very much for that introduction and for all of you for attending and being present today. Let me, I think I still need to share my screen. Is that correct?
Yep.
Okay, so let's do that. And are you all seeing what I'm seeing? What is dialectical behavior therapy?
Yep, it is in the presenter mode though, because we can see the side slides as well.
Let's see. Not quite sure. End slide display settings. Maybe,
There, that looks good.
Okay, perfect. All right, great. Okay, thank you. Yes, I will dispel diabolical behavior therapy. But I can tell you, I have had a client that has said exactly those words. What is this diabolical therapy you keep talking about? So, but we're going to talk about today what is dialectical behavior therapy and specifically who can benefit from it and kind of what it is. So without further ado, because I know I have a 15-minute infomercial of sorts, so I'm going to get rolling. Dialectical behavior therapy is multidisciplinary. So this means we include all disciplines who are relevant and important for that treatment team. Cognitive behavioral treatment. This is one of the reasons I think DBT is very adaptable and people tend to gravitate toward it because a lot of what is present is CBT, which all of us are already trained in. But it is designed specifically to target affect dysregulation in individuals with suicidal and non-suicidal self-injurious behaviors. So the original design of DBT, Dr. Lenahan, who is the individual that developed DBT, started with looking at people who were chronically suicidal and engaged in non-suicidal self-injurious behaviors. And it turned out that these were individuals that also happened to be diagnosed with borderline personality disorder. In order to help modify those behaviors, DBT also emphasizes basic behavioral principles. And I'm going to show a video in a moment that will kind of demonstrate to you what we mean when we say basic behavioral principles. These are the things that when you took your Psych 101 class, you more than likely recall, or maybe you want to not recall, but it's that Skinnerian Skinner box with the rat who's tapping the lever, and you're learning about positive reinforcement and negative reinforcement and punishment and operant extinction, all of those terms. DBT also includes Eastern meditative practices, so it borrows quite a bit from Zen Buddhism and the practices that we see that are relevant in that philosophy. And then it also uses a dialectical philosophy to better understand, shape, and change client behavior. So when we talk about dialectics, we're talking about really this notion that opposites can coexist. So if any of you are like myself, when you were initially being trained and people would tell you that you had an individual who was diagnosed with borderline personality disorder, they would say that they see the world in black and white, and your goal is to help them see the gray. A dialectical philosophy teaches individuals with BPD, and the way we approach the whole treatment system is that we're trying to not help people see the gray, we're trying to help them hold opposites together simultaneously. So if you think about the world is good and the world is bad, has certainly really amazing elements and certainly really negative, nefarious elements. And we have to hold both of those together. So to teach someone to try to blend these things becomes very difficult and results in that behavior that we see where individuals with BPD vacillate back and forth between those two pendulums of good and bad. So the goal is to help them hold both of them to create balance. I mentioned behaviorism. So what I would like you to do is just briefly take a look at this video. And I think in it, you'll be able to see Marshall Lenahan is really describing to this client how their behaviors are being reinforced. And in this circumstance, it's behaviors that we actually don't want to be reinforcing, which unfortunately happens more often than not within families and even within the mental health system.
Sorry, Denise, it appears that we don't have audio.
Ah, hang on. You're not hearing the volume?
No.
I wonder, we did share the
Here,
volume.
stop sharing and then.
Oh, you know, I don't know why we did all the sound check, but there it went. Let's see if this worked.
That if you try to kill yourself
There
or
you
say
go.
you're going to kill yourself, that's the effect of that is that other people take you seriously.
Yeah,
Okay.
it's the only way they'll take me seriously.
This, of course, is the problem. People take you seriously in the hospital. And being taken seriously is a reinforcer for you, I'm almost sure. It's a reinforcer for most people. And so if you get taken seriously every time you say you're going to kill yourself, or when you do try to kill yourself and you don't get taken seriously any other time, you can count on it. You're going to keep threatening or keep trying to kill yourself. That's just the way it works.
So in this example, I think what you can see is that this is an individual who unfortunately is getting reinforced when they are suicidal and basically being ignored whenever they're not. And so in DBT, we're paying attention to these reinforcers. We're paying attention to what's happening in the individual's environment. And an intervention, for example, here would be to work with the family to help them pour on attention when this individual is behaving skillfully and is managing problems by not resorting to suicidal threats. And then perhaps even doing environmental interventions where, when and if they do go to the hospital, it may not necessarily be as attention providing as we would formerly have had it. So since this time, since DBT was first developed, or the first original randomized controlled study done in 1991 for individuals with BPD, it has been adapted, modified, implemented to various populations, settings, age groups, and so forth. And so since that time, DBT has subsequently evolved into a treatment for chronic, multi-diagnostic, difficult to treat populations for which emotion dysregulation is central to the maladaptive behavior. So any type of behavior or diagnosis where individuals are engaging in unskillful means or methods to regulate their emotions, DBT is appropriate for. So that might be substance use disorders, that might be eating disorders, that might be anger management, and so forth. So looking at what is DBT and what does a comprehensive DBT treatment look like? There are basically what we call 4 modes of treatment. Individual psychotherapy, in which the individual is a DBT therapist. DBT group skills training, where we're actually teaching these coping skills in a very formalized kind of classroom almost like setting. DBT telephone coaching, which provides after hours consultation for the client, and team consultation. So briefly, looking at each of these, individual psychotherapy, the individual typically meets with their therapist 1 to 2 times per week. The individual therapist is skilled and trained in DBT techniques and methods, and their central goal is to balance change with acceptance. How do clients, how do therapists promote acceptance? They're validating emotions, they're validating the client's experience, but they are not validating invalid behaviors. That means we can understand how a client could become dysregulated and upset, but we're certainly not going to be validating behaviors such as self-injury or ways that they're coping with that in a maladaptive way. How does the individual psychotherapist promote change? Their goal is to replace maladaptive, unskillful behaviors with skillful, adaptive behaviors. And they do this primarily through what we call a behavior chain analysis, which is a very detailed step-by-step intervention of identifying what are vulnerability factors, prompting events, links in the chain, the problem behavior, and all of the consequences that precede that problem behavior, and then implementing change strategies and solution analysis with that. The individual therapist also organizes and structures their individual treatment according to this hierarchy. So the very first thing that they are addressing is anything that's happened in the past week where the individual has engaged in any type of life-threatening behaviors. The second thing they're addressing after that is accomplished is they're looking at any type of behaviors that are therapy interfering behaviors. These are behaviors that can burn the therapist out and preclude effective treatment. They may be things like not showing. They may be things like coming to treatment impaired or intoxicated. They could be being physically or threatening in any kind of way to a therapist and so forth. The third are quality of life interfering behaviors, and these are behaviors that we typically see in outpatient settings. They deal with relationship issues, they deal with employment, they deal with housing, and so forth. And then lastly, the individual therapist is always weaving in DBT skills to help the client promote that behavior change. The second mode is DBT group skills training. When individuals participate in group skills training, they are learning what we call 4 modules. And in each of these modules, we're teaching a set of skills. The first are what we call core mindfulness skills. This is the area that is borrowed from Zen Buddhism. And these are skills that teach clients how to be present, to stay in the moment, how to engage wise mind and make thoughtful, methodical decisions as opposed to impulsive, heated decisions. The second set of skills are the distress tolerance skills. And these are the skills that we ask clients to use whenever they need to tolerate a situation that they simply cannot change. And that may mean being able to sit with negative emotions without acting on them or making a situation worse. The third are interpersonal effectiveness skills. These are quite similar to what we see with assertiveness training. So we want to help teach our clients in this set of skills how to be assertive without being aggressive and how to be assertive without being passive. Emotion regulation skills are skills that we use that help clients re-regulate their emotions and actually change what they're experiencing or feeling emotionally. DBT group skills training occurs for 2.5 hours per week, and that can be divided up in any way depending upon the setting, whether it's an intensive outpatient treatment or it's once weekly and so forth. I'm going to just show you briefly this video so you get a feel of how didactic it is.
A lot of times I could get so anxious about something that you know I just blank out or something, you know. At that point, appearing confident seems almost like
Seems like the hardest thing to do, yeah.
yeah, I mean,
That might be something that
a lot of times I could get so
So you can notice there it's very much like a classroom setting. The third mode is DBT telephone coaching, and the clients are provided access after hours to their therapist. The goal here is to decrease suicidal and non-suicidal self-injurious behaviors. Again, historically, clients who engage in these behaviors have a lot of time and attention poured on them after their self-injurious event. We're trying to change that reinforcement schedule where they are being rewarded for being skillful and adaptive by calling prior to feeling suicidal and or engaging in non-suicidal self-injurious behaviors. The other part is that it helps clients generalize their coping skills to everyday problematic situations, and of course teaches them how to ask for help more adaptively. There are, of course, some rules in place. They need to call prior to making a non-suicidal self-injurious attempt. And if they do engage in self-injury, they of course have to go through the proper medical procedures to receive care, and then they are not permitted to use phone coaching for 24 hours. If a client becomes where they're overusing or even abusing by calling too frequently, we can also insist that they go on a vacation or holiday from phone coaching. The fourth component is DBT Team Consultation, and this is where the DBT team applies DBT therapy strategies to the therapist in a supportive yet problem-solving framework. In essence, all of the skills that we are using and learning and putting forth to help our clients, we are also applying those to our team. So in other words, we are validating our team members, and at the same time, we're trying to promote change to help them work harder, do better by their clients. In DBT Team Consultation, the team generally meets for 2 hours each week. So who can benefit from this treatment approach? So these are some of what, when I think about the research studies that have been conducted out there and what population, we have individuals who are diagnosed with borderline personality disorder, PTSD, eating disorders, substance use disorders, conversion disorders, schizophrenia even, non-suicidal self-injurious behaviors, depression, anxiety, ADHD, bipolar disorder, and of course, individuals who have chronic suicidal ideation and or make attempts. What settings can DBT be used in? DBT has been used in community mental health settings, outpatient private practice, residential treatment centers, intensive outpatient treatment, partial hospitalization programs, inpatient settings, and school settings, as well as forensic and correctional settings. And then lastly, I know many of you are working with children, so you want to know what age is appropriate for DBT. So dialectical behavior therapy was originally designed for individuals who are 18 and older. Since that time, researchers have developed a treatment manual that is called Dialectical Behavior Therapy for Children, or DBTC. That is appropriate for kids ages 6 to 12. And then Alec Miller, along with Joe Rathis, have also developed DBT for adolescents, or DBTA, and that generally is for individuals age 13 through 17. Lastly, Tom Lynch has also done research. It's not necessarily an independent model on it to itself, but has done research with geriatric or elderly populations of individuals 60 and older. So when you think of what age, probably any age barring that preschool, early childhood age. Lastly, how do you find a DBT therapist? So first is behavioral tech, and there's your website if you're interested in finding that. So behavioral tech is the organization that was developed by Marsha Lenehan. It's also the organization for which I'm a DBT trainer for. And you can see on her website at this place, teams that have been specifically trained in DBT, as well as individuals like myself who have been intensively trained in DBT. Secondly, there's the Lenehan Board of Certification. And if you go to this link, you'll also be able to find therapists who are certified in DBT by simply indicating your zip code. And that certification is a much more rigorous process, and certainly those are individuals who are very well versed in DBT. And then lastly is Treatment Implementation Collaborative Group. And they as well have a cadre of solid clinicians who are very well versed in DBT. So I have us at 4 minutes before we leave at 12. So I'm going to turn this back over and see if there are questions or if we have time for questions. And I'll stop my share and put us all back together.